Hello everyone, my name is Hill, and today I'm really pleased to be here to present our topic about the factor affecting health indicator of diabetes. Hope that you guys will bring a new side to this topic. So the first is the overview. We have seven big types here. Is the first one is introduction. The second one is the diabetes overview, dataset description, and methodology, results, discussion, conclusion. The last. First is the introduction, and we'll come to the small parts of introduction. So the little review. Diabetes is a chronic disease with rising global prevalence, leading to serious complications if unmanaged. Key health indicators like blood glucose, BMI, blood pressure, and insulin levels are vital for early diagnosis and management. Understanding how this is affected by lifestyle, genetics, and demographic supports better treatment and public health strategies. The second part small is a problem statement. This project aims to identify the key factors that influence diabetes-related health indicators, such as blood glucose, BMI, and blood pressure. Using data mining techniques, we analyze a structured dataset to rank variable importance, uncover hidden patterns, and support early diagnosis and risk assessment. The goal is to align data-driven insights with existing medical knowledge to enhance healthcare decision-making. The problem goal, the project addressed by the following question: which variables contribute to most significantly to variation in health indicators like glucose level, BMI, or blood pressure? So, how do these factors rank in terms of the information to gain predictive importance? Do the finding align with established medical knowledge regarding diabetes risk and management? The problem method. Other AI Studio was used for analysis. It integrated RapidMiner Studio's capabilities in a visual, no-code environment. The platform support is data loading and cleaning, feature selection, model training, and evaluation. Key operator used like replace missing values is to handle incomplete data, set role to define health indicators as target variables, weight by information gains to rank features by importance. Why Alta AI Studio? Visual and intuitive design, transparent workflows, ideal for exploratory data mining. And next, the project structure. So we'll come to diabetes overview. First is a historical and current state of diabetes. The historical is that diabetes has been known since ancient time, but effective treatment began with the discovery of insulin in the 20th century by rising prevalence from 1980s. 108 million adults with diabetes. 2014, that 422 million. Main drivers of increased aging population, obesity, and physical inactivity. Proceed high calories diet, energetic risk, and modern lifestyles. We have five types of diabetes. First, we'll talk about the cause of it. The first kind of diabetes is caused by the autoimmune destruction of beta cells, genetic predisposition, and possible viral triggers. About onset, it was studied. The treatment for this type of diabetes is the lifelong insulin therapy or regular blood glucose monitoring health lifestyle. The key features here is a rapid weight loss, frequent urination, and extreme thirst fatigue. The second type of diabetes is obesity, physical inactivity, poor diet, or genetic factors, and aging. By time is gradual, often in adulthood, but increasingly seen in youth now. The treatment for this kind of diabetes was the lifestyle change, oral medication, and possible insulin. Often a symptomatic at first, fatigue, blurred vision, slow while healing. The next one is gestational diabetes. Hormonal change during pregnancy, increasing insulin resistance during pregnancy, typically 24 to 28 weeks. Dietary change, physical activity, and sometimes insulin or oral medication was a treatment for this kind of diabetes. Often no symptoms detected through routine pregnancy screening. Next is a risk factor. There was four most risk factor: the age, family history, ethnicity, and genetic predisposition. The risk of type 2 diabetes increase as people that get older, particularly after age 45. About family history is having a parent or some sibling with diabetes, increase an individual risk. Certain ethnic group, including people of South Asian, African, Hispanic, and indigenous descent, have a higher risk. Genetic predisposition, specific gene variants can increase susceptibility to diabetes. Next is the modifiable risk factor. First is the overweight and obesity. Excess body fat, especially abdominal fat, is a major driver of insulin resistance. Physical inactivity, a sedentary lifestyle contributes to weight gains and reduced insulin sensitivity. Unhealthy diet, high in saturated fats, sugar, and processed foods are likely to higher diabetes risk. Hypertension frequently consists with diabetes and increased cardiovascular risk. Dyslipidemia, abdominal cholesterol level, particularly low HDL or good cholesterol and high triglyceride are associated with insulin resistance. Smoking, tobacco use increase diabetes risk and amplifies its complications. Gestational diabetes history. Women who had a gestational diabetes are at higher risk of developing type 2 diabetes later in life. Next is the health effects of diabetes. Cardiovascular disease increase the risk of heart attack, stroke, and vascular issues. Kidney damage is leading to cause of chronic kidney disease and renal failure. Nerve damage cause pain, numbness, or weakness, especially in limbs. Eye damage can lead to vision loss or blindness. Amputation due to the infection from poor circulation, and nerve damage. Last one is the role of significant of health indicator factors. Health indicating factors are measurable attributes that reveal a person's health status and risk of developing diabetes or related to complications. Key indicators include blood glucose levels, BMI, blood pressure, insulin levels, age, and genetic predisposition. Identifying the most influential these factors is essential for early detection, risk assignment, and personalized intervention. For instance, elevated BMI and insulin resistance are no precursor to type 2 diabetes, while blood pressure control is vital in managing cardiovascular risk. With data mining and machine learning, researchers now can analyze large datasets to rank this variable by importance, uncovering patterns beyond the reach of traditional methods. This data-driven approach supports precision medicine by tailoring prevention and treatment strategies to individual needs, while also guiding effective public health planning through insights at the population level. Next, we'll come to dataset description. The dataset contains medical and demographic data for 768 female patients of Pima Indian heritage. The Pima Indians diabetes dataset is chosen for this project for the following reasons. Its balance of medical, lifestyle, demographic variables, it focuses on its risk factors relevant to type 2 diabetes. It's suitably for data mining tasks such as feature selection, classification, and regression. First is the data attributes. The data set consists of 8 input features and 1 output class. The attributes are pregnancies, which the number of times the patient has been pregnant. The data type was integer. Glucose, the plasma glucose concentration after 2 hours in an OGTT. Data type is numeric. Blood pressure, diastolic blood pressure. The data type is numeric. Skin thickness, the triceps skin fold thickness. The data type is numeric. Insulin, 2-hour serum insulin. The data type is numeric. And BMI, the body mass index. Data type is numeric. Diabetes pedigree function, the diabetes genetic risk score, higher equal to greater risk. Numeric data type. Age is age in year. Data type is integer. And outcome, diabetes status 1 equal to diabetes, 0 equal to no diabetes. The data type is binary. Next is the data quality and pre-processing. Upon the inspection, the dataset contained certain attributes where 0 values are physiology implausible. These 0 values represent missing unmeasured data points. To address this, the replace missing values operator was applied in Altair AI Studio to replace such values. Average values were used for numeric attributes were appropriate. This ensured that no missing or placeholder values bias the feature's importance analysis. All attributes were retained in the dataset for analysis. The outcome attributes served as either a predicted target or comparative reference, depending on the health indicator being analyzed.
Okay, so follow up with Kyo, Introduction to Diabetes. Here's my detailed evaluation of our methodologies. So our project is apply data mining techniques to identify factors that influence key health indicators related to diabetes, and we're doing so by using the AI Studio or Rapid Miner Studio, a visual analytics platform that allows us to construct the modular workflow without programming. So our main objective of this method was to process and clean the dataset for accurate analysis. We also designated specific health indicators like glucose level, BMI, blood pressures as target variables. And we also applied the feature important techniques to rank the input by their contribution to the target indicators. And we also optionally to build a predictive models for validation, though this might be a more of a feature work. The software that we're using is the AI Studios, incorporating with Rapid Miner Studios, and we selected for a bunch of reasons like user-friendly, drag-and-drop interface, wide range of built-in operators, transparency in workflow design, and visually output the features. So our workflows is broken up into different steps, and we're using different operators for each of these. Now, we obviously have to load the data in first. So our Pigma Indians diabetes dataset was downloaded and then imported from a local CSV files using the read CSV operator. Now, in the program, we also have to do some data cleaning first before we can do any of the actual analysis. We're doing so by using the replace missing value operators to address some physiologically impossible zero values in the variable across different features such as BMI, blood pressures, etc. And the default method, average value imputation, was applied for numeric attributes to ensure data completeness without introducing bias. We're using the set row operators to setting the target variables. So this used to assign the target health indicators for analysis. Separate runs was performed for different indicators of interest, like the glucose level, BMI, and blood pressures, allowing the comparison of features' importance across indicators. And finally, we're using the weight by information gain operators to rank different features by their attributes. To rank their attributes based on their information gain with respect to the target indicators. We can also use additional weighting method like the weight correlation or weight by Gini index to optionally use to cross-validation results. And our result visualization is also exported from the program. We can see that in the result view of the program, and we screenshot and export the data that were generated and imported into this finding and report. And you can see it in the next slides of our presentation. After this one, we also have some justification for our method, like the information gain is widely used in feature selection because it quantifies in the reduction uncertainties about the target variable provided by each features. The average imputation of missing values is a simple yet effective method for handling missing numeric data without distorting distributions when data is moderately clean. Using a visual tool like AI Studio also ensure transparency, reproducibility, and clarity in documenting the analytical process. So here are the results, as you can see, shown in table. So the results, so the features important analysis were conducted using the weight by information gain operator in the OAI studio. The objective was to determine the relative contribution of each input variable to a selected health indicator. The analysis focuses on understanding how features such as age, BMI, insulin level, and pregnancies influence key health metrics related to diabetes. And we summarize that into this table. The value itself is not exact because we rounded and approximated the value up, so it's showing much more clear results. And we have some interpretation of our results, like the outcome emerges as the most informative variable in relation to the target indicator. So this suggests a really strong relationship between the target health indicator and diabetic conditions. The insulin level provided substantial information gain consistent with its central role in glucose metabolism and diabetes pathology. The age and BMI contribute a bit less, but also reflecting the known association of these factors with diabetes risk and health outcomes. The blood pressure is showing an even more smaller portion, but still notable contribution, supporting its role as a comorbidity factor in diabetes and management. Other features such as skin thickness, pregnancies, and diabetes fetus function provided a low level of information gain, though they still contributed to the overall picture. So here's the result that we gain, and visualize that in a bar chart. As you can see, the outcome with the most influence will be shown the largest value, and then follow up in the tree, we're gonna see less and less features are getting less and less. So that's showing their importance in the outcome. And our results is quite consistent with the medical understanding as we know so far, like the insulin level are directly linked to glucose regulation, and it's one of the core issues in diabetes. The age and BMI are recognized risk factor for type 2 diabetes and its complication. The outcome, or diabetes status, naturally provides high information gain when analyzing diabetes-related indicators. The lower ranking features, such as skin thickness and fetus function, may reflect dataset characteristic or specific relationships within the sample population. Some additional notes that we have in this results is like the analysis was conducted after the replacing missing values to ensure data integrity. The weight provide a relative measure of importance, but do not do so to indicate causality. Further analysis, like using the weight by correlation or building a predictive model, could validate or extend these findings. So, as we discussed earlier, our results pretty align with the medical knowledge, like the outcome provided the highest information gain. So this is expected because diabetes status is inherently related to glucose metabolism and other health indicators, and glucose metabolism is directly controlled by the insulin level, that is the hormone in our body that regulating blood glucose. And the insulin level is a really strong indicator that is consistent with the pathopsychologically of the disease. Elevated or deficient insulin level are directly linked to insulin resistance and beta cell dysfunction, which underline type 2 diabetes. Other factors also pretty line up very well with our medical understanding, as we can see in the slide. And there are a few implications that we can highlight in our research, like the data-driven methods, like information gain analysis, can successfully rank factors in a way that mirrors clinical understandings, supporting their use in health research and decision-making. The analysis reinforces the potential for machine learning techniques to enhance personalized care by identifying which factors matter most for different individuals or populations. Insulin, BMI, and age should be prioritized in predictive models or risk assessment tools focused on diabetes management, as they provide substantial information about health indicators relevant to diabetes. There are a few limitations of our research that I would like to point out, like we cannot infer the causality in our research since the method identifies variables that reduce the uncertainty about the target, but do not establish a cause and effect relationship. Our dataset is also really specific. It's one population group of women in India, so the results is not so much generalized to, say, like other ethics, genders, or a broader population as a whole. Some variables had a really high proportion of missing or zero values, like the skin thickness or insulin, which were replaced using the average imputation. Though this allowed the analysis to proceed, it may have diluted the true sign of those features. The only one weight method, the information gain, was applied in this report. We can strengthen it by using other methods like weight by correlation or Gini index, or building a predictive model itself could provide a much more validated result and enrich our findings. So this opened up the room for our opportunities in future works, like we can apply multiple features selection techniques to cross-validate the importance rankings. We can also develop a predictive models using the rank features and evaluate their importance. We can also extend the analysis to other datasets, so it's showing a much more clear picture, and we can also explore the interaction between features like age, cross, BMI to uncover even more complex patterns affecting health indicators. So we have a few conclusion of research, like the objective is to aim to identify key factors influencing diabetes-related health indicators using the Pigma Indian Diabetes dataset and data mining technique. Our method using here is using the Altair AI Studio and the weight by information gain method. Variables were ranked based on their contribution to a selected health indicators. Though this research have some limitation, like the study use a single dataset, apply only one feature selection method, and rely on imputative values, which may not be generalized. And this leads us to the conclusion, like data mining through an effective in uncovering key health patterns in diabetes. The finding also support the use of personalized data-driven approaches in disease and prevention and management. So that is all about our presentation. Thank you for listening.